Hello and welcome back. We are now on to the section of Chapter 9 where we're just going to take a closer look at some selected articulations. I think the book calls them representative articulations. So they're just some of the major joint locations in our body that a lot of people deal with, usually because there's an injury of some sort. So we want to get down the anatomy of those joints. So the first one we're going to take a look at is intervertebral joints, which are actually pretty complex because your vertebrae is a pretty complex structure made up of multiple vertebrae interacting with each other. So let's go ahead and take a look at what we have. So again, in the notes, there's a list of the structures that you will be taking a look at with the discs themselves and with the ligaments. So everything that you need to know for these representative articulations are listed in the notes. So the first thing I want to talk about is the joints themselves. There's actually two joints that are going on between two what we call adjacent vertebrae. So the adjacent vertebrae are the ones that are stacked on top of each other. All right, I took a pause real quick because I went to grab some vertebrae. All right, so I can kind of give you some visual, hopefully if I can get everything correct. So these would be like two adjacent vertebrae. So the places where we're going to get articulations is one is between the bodies of the vertebrae, where the vertebral discs are going to sit, right? So this surface right here. The other place that we see articulation is between the superior and inferior articulating processes of the adjacent vertebrae. I know that's a mouthful, but if we take a look right here, where we have the inferior articular surface is coming up against the superior articular surface. This is another articulating surface. Yikes, right here. This is a synovial joint. So when we talk about synovial joints, it is between the superior and inferior articulating surfaces of those processes. When we're taking a look at the vertebral discs, like if my finger was a cartilage disc here, this is an amphiarthrosis. This is a symphysis joint. Remember, so slightly movable cartilaginous joint would be found between the bodies, where your synovial gliding joint here is going to be your synovial joint. Okay. So what is the disc, the vertebral disc? So we have that highlighted, kind of boxed in right here. So we have kind of three components. You have what's called the vertebral end plate, which is just the cartilage, the outer layer, if you will. And then you have the bulk of the fibrocartilage, which is called the annulus fibrosus. Annulus kind of means ring, made up of fibrocartilage. And the inside, the nucleus means inside, so the nucleus pulposus is a softer, kind of the cream filling, if you will. I always analogize the intervertebral discs to like a ding-dong cupcake, right? So you got the chocolate cake around the outside, which would be your annulus fibrosus, and the creamy center would be your nucleus pulposus. So the job of these intervertebral discs is to separate the bodies of the vertebrae so they don't rub up against each other. You need something to protect those bones. And because it's fibrocartilage, it's very compression resistant, which is good because every time you take a step and you're walking, you're going to compress on those vertebral discs. So when you have problems with those, like a slipped disc or a herniated disc, which I have some good x-rays here to show you in a little bit, then you're going to have pain and you're going to have some back issues. So just the intervertebral discs themselves can cause some problems for your back health. All right, so now let's take a look at the vertebral ligaments, intervertebral ligaments. It's the ligaments that hold the vertebrae together. So I'm going to start with the anterior. So this is the anterior surface of the spine, right? Because your spines are all the bumps on the very back, kind of pointing toward the back. So if you remember, these are lumbar vertebrae. They look like moose, right? So the moose faces point posteriorly, which means the rounded part of the body technically is the anterior part of your spine. So we have kind of well named the anterior longitudinal ligament. So it's just going to run all the way along the surface, the front of all of these bodies of the vertebrae. And then we have the posterior longitudinal ligament, which will run, so if I show you the hole, it's going to run right along this surface here on the posterior part of the body, right there. because you remember the spinal cord is sitting right here. So if this pencil is the spinal cord, we've got to protect that spinal cord, and we have to hold all of our joints together. So anterior longitudinal ligament will be here, posterior longitudinal ligament would be there. Okay, and then we have what's called the ligamentum flavum. Ligamentum flavum. So, and you can kind of see it a little bit better in this perspective. I don't know if you'll be able to see it too well here, but it's going to be a little ligament that's going to be on the very posterior, like right where my finger is, right? So the posterior longitudinal ligament is going to be on this side of the opening. The ligamentum flavum is going to be on this side of the opening, kind of right here, holding those adjacent vertebrae together, right behind the nose of the moose, if you will. Okay. And then we have the interspinous ligaments. So if we look laterally here, see this space right where my finger is? Okay. So this is the ligamentum flavum. So there's going to be a little bit of ligament here that's going to connect the spines together, but in this orientation, kind of from top to bottom. And then the last one is called the supraspinous ligament, which if we look at our moose, it's going to run right along the noses of our moose and our giraffe and stuff. So the supraspinous is going to be like right along here. So those are the 5 ligaments associated with intervertebral joints. So we had the structure of the intervertebral disc, and then we had the 5 ligaments. So anterior longitudinal, posterior longitudinal, ligamentum flavum, interspinous, and supraspinous. Okay, and then you can see the spinal cord sitting right there in the middle, right there, in that hole. The vertebral foramen, right? Remember some of our stuff from the bone list. Okay, the next thing I just have some pictures, yes, and some pathology of slipped and herniated discs. So of those fibrocartilage discs that you have in between your vertebral bodies, we have 2 kind of levels of injury. So a slipped disc is where that nucleus pulposus, the soft squishy center, is kind of bulging out a little bit, but that annulus fibrosus is holding it in. It's not ruptured at all. So that would be what we call a slipped disc. A herniated disc is where that nucleus pulposus breaks through, that annulus fibrosus is now ruptured, the nucleus pulposus gets squished out and kind of oozes out, and sometimes it can get hard and calcify even, and then you're compressing these spinal nerves, because the spinal nerves come out at every level of your spinal cord. So here we can see a herniated disc. This bulge here is the nucleus pulposus kind of oozing out. Here's a bulging disc, so this would be like a slipped disc here, and then here's the herniated disc here, compared to the normal disc up top. And then here's another example of a herniated disc over there. Very painful, and you'll notice quite a few of these, they're very down close to the lower lumbar. There's 5 lumbar vertebrae. These all look like they're between L5 and S1, or maybe within the lumbar vertebrae, which kind of makes sense because it's the base of your spine. So it's going to take more compression than, say, some of the vertebrae that are more superior in your spine. And then lastly, this was an x-ray sent to me by a student, actually, who had this procedure done. And if you'll notice, this hockey puck looking thing is an artificial disc. So this individual had 2 of their vertebrae kind of fused together with these screws and a plate and an artificial disc in there to separate the bones. So the vertebral bodies aren't squishing onto each other, and they're not squishing the nerve that would be coming out of that intervertebral foramen. Okay, so that's our little mini lesson on intervertebral joints, and I will see you next time when we take a look at some other representative articulations. All right, bye.